This is Jayashree, CWC Wellness Champion for nearly 3 years. Let me introduce. So, Dr. Kusum Bhatt, welcome to the event.
Thank you, ladies and gentlemen. My topic today is gut biome GPS for mental wellness. You have heard an excellent talk earlier, and my job today is to simplify and give some practical tips of what we should be doing to for our gut biome or gut, and then I will start with old roadmap, which is a mental wellness, which is in your head brain, and our new theory is the mental health is in your gut brain. The past theory of it said this: the chronic stress, susceptibility genes are all have the psychological dysfunction. The new theory says it is, and then for the old susceptibility gene and chronic stress, in the old theory, the solution is medication and psychotherapy. The present discovery is chronic stress, antibiotic, poor diet, unhealthy lifestyle, which leads to microbiota gut-brain axis dysfunction. And that affects your gut brain. In turn, it affects your brain, the head brain. So how do we get treated or get better? By healthy diet, psychobiotics, and prebiotics, and fecal microbial therapy. To talk about all that, what is my qualification? I have been with the CWC for a long time, and we have done several sessions on stress and how to get do the stress control, and also stress and heart disease. And then my biggest qualification is, and we are doing this and practicing this in our 6 different clinics, training the coaches as well as educating our patients using the theory of improving your gut balance. So I will give you some of the practical tips and as well as some of the theories, because let's start with 2 parts of this presentation. One is gut biome GPS for mental health, which is, and mental health pivots from gut brain rather than the head brain. The other one, other tools to foster your gut brain health, that is, I will give you the 2 different tools: gut level tools and brain level tools. So what is the theory behind it? The world's largest gut biome research is done at UC San Diego. By the way, that happens to be my alma mater. The Microsetta research using American Gut Project and British, is a conglomerate of American Gut and then British Gut Project. And the other one is review of gut biome research during pandemic. Who did not have stress during the pandemic? We still have, it is not over. So mainly because of uncertainty and forced isolation made people more depressed and anxious. And in this study, they said correcting your microbiota and helped for depression and anxiety. And then there is a new latest study has WHO, what it says is during the pandemic, the increase in the depression and anxiety is 25% more, 35% more in women, especially young women. So that is something we had to think of. And today's the topic is empowering women, and I just wanted to mention that it is the depression and the anxiety has increased during the pandemic is more in women. Then we'll talk about the new science of I just keep going. Okay. And the new science of mental wellness. One is a stress resilience and how to balance your gut biome. The old paradigm is stress management was managing your stress by either from body to mind or mind to muscle, or muscle to mind, or mind to muscle. And the flip side of that is stress resilience. And the emotional intelligence is the flip side of emotional resilience. Intelligence is versus emotional resilience. How do you balance your gut? Like you heard before, prebiotics, which is a food for probiotics bacteria, and probiotics is a beneficial bacteria, and the postbiotics, which is psychobiotics. What is the stress resilience? Stress and emotional distress level have three components. To begin with, the definition is emotional resistance is ability to bounce back emotionally after experiencing distress. The stress and emotional distress has trigger or stressor. In psychology, we call it a trigger or stressor, and then the stimulus, and the reactivity is called a response, a flight or fight reaction, and the resolution or resilience. If I can give you an example of a boss that you are working with has yelled at you, and then you don't know how to take care of yourself, and then what happens to your body and your as a response, each person has a physiological signal. You may start sweating, you may clench your jaw or start rapid breathing, and then all of these has a gut role. And the more the resilience you have by correcting your gut, and your stress is relieved. What happens there, why it happens? It depends on neurotransmitters called GABA, dopamine, serotonin, and these are the calming chemicals. And then the leaky gut you just heard, that is inflammatory cytokines, and that is the reason this happens. But it can be corrected. And gut and brain are connected by two pathways. One is a hardwire, which is the vagus nerve, and then the sympathetic nerve. And the other is the bloodstream, and then that has neurotransmitters, bacterial cytokines, and immune moderators. So your gut brain talks to your head brain, and the head brain talks to your gut brain. The vicious cycle continues. Unique gut biome in the umbrella of mental disorders, how to treat these mental disorders using the gut biome. And I'm not going to go into the details of many of the disorders, though it is my specialty. We have done that in the past, and that is, I have a doctorate in clinical psych, as well as behavioral medicine, and stress management. But today's focus is under the umbrella of mental disorders. We will talk about few common ones like mood disorders and some psychotic disorders and anxiety. The common mental disorders, like we said, is anxiety, depression, and schizophrenia. They each have unique gut bacterial pattern. And fecal microbial transfer that we heard of can transfer emotion and behavior. Most exciting finding is autism spectrum disorder that can be improved by fecal microbial therapy. And then the irritable bowel syndrome. Irritable bowel syndrome is not only irritable bowel, it's irritable mind as well. Most importantly, and I want to talk about weight gain or weight loss based on Firmicutes bacteroides ratio in the gut. The reason is, and then I like I mentioned, I work with 5 or 6 pediatricians and endocrinologists, and then we treat that in our clinic using these techniques. There are two-pronged solution for this. One is a gut level and then the brain level. The goal in the gut level is increase the gut bacterial diversity, shift of Firmicutes bacteroides ratio, and using prebiotics to increase lacto and bifidobacteria. And food has 2 components: when you eat and what you eat. When you eat is 16-8 fasting that fosters bacterial diversity. And what you eat, that's plant-based approach, 3 P's: prebiotics, that is resistant starch and polyphenols, probiotics, and postbiotics are psychobiotics spore form. There was also a study done: adopt a dog, bring dirt and bacteria from the outside. It sounds silly, but that works. And we use a similar theory in treating allergy patients. The hygiene hypothesis, being in a dirt, kid has better tolerance of allergy compared to otherwise. Similarly, so this is one of the theories. Let's see why so, and what is dysbiosis. Ultra processed food that we are eating, like a pasta, rice, and all of that which are processed, that makes your gut dysbiosis, that stops or reduces the butyrate, acetate, and propionate that needs to have a healthy gut. So dysbiosis is the low diversity, low keystone bacteria like Akkermansia, low lactobacillus and bifidobacteria, and then it leads to leaky gut, LPS, and translocation of the inflammation. So, what is restricted eating and mimicking diet? We use this in our clinic extensively, and 16-8 is either you skip breakfast or skip dinner. We do little bit modified in this one, because not everybody can skip breakfast or dinner and 16 hours. What we recommend is, with your coffee or tea, add MCT oil or MCT powder, or have half an avocado. The purpose of that is that gets you into a nutritional ketosis. So by doing that, and then your gut bacteria improves, and then you are able to maintain your weight, and if your goal is to lose weight. What to eat? Or before that, we would say, feed first and then you eat. What do you feed? Beans, lentils, and what I would say is when you take your plate, half of your plate should be filled with what we call Big Mac, that beans and lentils, and polyphenols. What are the polyphenols? Polyphenols are colored vegetables, and a different color, purple, green, red, and then those colors. And then after that, and not only that, resistance starch. After that, whatever you want to eat is your choice, but have more beans and lentils and colored vegetables. And let's talk about what are prebiotics. Prebiotics are fertilizer for microbes. These are that we have talked about, beans and lentils. Resistant starch. What is resistant starch? Resistant, like a green banana or green banana powder, or potato starch. Make sure it is not a potato or potato powder, it's a potato starch, or potato cooked and cooled. Those are resistant starch. And polyphenols that we have discussed, like for example purple eggplant, or beetroot, and those are the purple, and then you all know what green and then white vegetables are. And two-pronged solution we talked about. Brain level, yin and yang, that is the vagus nerve is yin and yang is sympathetic. The goal is to increase your vagal message by most effective is slow breathing. In our clinic, we use this device that is melody guided breathing technology that prolongs the exhalation. And then yoga stretching and mindfulness or shavasana, and massage is self massage or getting the massage, which releases the oxytocin. So, if we say that happiness in a capsule, can we have a happiness in a capsule? Probably so. So, targeted delivery of spore-based psychobiotics are available. For your information, I have given you. One of them is Bifidobacteria longum 1714. And then the why? Because to increase some of these neurotransmitters. What are the neurotransmitters we are interested in is dopamine, oxytocin, serotonin, and endorphin. Dopamine is a reward chemical. Serotonin is a mood stabilizer. Oxytocin called a love hormone, and endorphin is a reducing pain hormone. So to conclude, gut biome GPS for mental health again is a mental wellness in your head brain, and is the old map, and the new GPS is mental health is in your gut brain. I just wanted to say thank you very much for giving me this opportunity.